As ever, lots to discuss then. Let's focus first now on the NHS. I'm joined by Dr. Larisa Corda, an obstetrician working in a major London hospital, and by our political correspondent Carl Dinnan, who'll be with me throughout the programme. Larisa, we spoke to you a week ago, a week on. How have things changed in your hospital?
So I think, generally speaking, across the entire UK, there are very real concerns from frontline staff within all of our hospitals about the issue of personal protection equipment and whether we've got enough. We're hearing rumours about people having to borrow things, having to buy stuff from DIY shops, that we haven't got enough, that our supplies are also being depleted. So hand sanitizers are going, masks are being taken from hospitals. And we fear that there's going to be a real shortage as this crisis starts to escalate. This is sort of the calm before the storm, but we're really fearful and anxious of the fact that when numbers do start to hit us in terms of the number of patients who are affected by coronavirus, we're just not going to have enough to cope. So we need proper reassurance from the government that actually we are going to be protected on a very physical basis from being able to contract the virus ourselves, so we can keep working and we can help also protect our own families and our own households.
And what about you right now in your hospital and your colleagues when they walk through the hospital doors, when they go into surgery? Have you got the right gear?
Yes, we do at the moment. I mean, there's a lot of reassuring stuff that's been put into place at the moment, and all the necessary measures and precautions have been taken. And we're fine for the time being, but we fear that in the future, supplies may quickly start to run out. And we've already seen our own supplies start to run out and things being taken from the hospital. We're not sure who's taking it, but I think, it's a combination of a lot of fear and panic that's gripping people. And, we're trying to offer reassurance during an incredibly stressful time for all of us, but actually we fear that there may not be adequate protection for us. And it goes even further than that. We're talking about physically protecting doctors here when they're coming into contact with patients, but my other concern, and the concern for a lot of my colleagues, is how we also mentally protect doctors during this crisis, when our hours will be significantly increased and we're going to have to work for days on end in order to try and deal with this crisis. I'd like to know what the government is going to do about that as well.
Yeah, absolutely. Carl, this issue on the physical side of it, first of all, the issue of this protective equipment still hasn't been resolved, has it?
It's a real problem, yes. I mean, the Prime Minister said, as you mentioned earlier, that 7.5 million pieces of personal protective equipment have been delivered over the last 24 hours. The Army is involved in getting that out to hospitals, but we are still hearing from healthcare workers that it hasn't necessarily arrived with them yet. And it's not just hospitals, it's social care as well. Unison, the unions, say that in care homes, their staff aren't getting the right equipment. Today, the Prime Minister said they would have it by the end of the week, but it's clearly a real problem. Even the Healthcare Supply Association, Jeremy Corbyn pointed this out at Prime Minister's Questions today, have asked for DIY stores to donate goggles and visors. So really an issue still for the government, even though they say a lot is being done.
Larisa, on this issue of social distancing and people staying at home or not, some people aren't abiding by those instructions. We saw the pictures yesterday of Excel that's going to be turned into a hospital. In terms of the lag, do you think people will now get the sense of how serious this is and more people will get infected and more deaths will come, unfortunately?
I mean, I think the message is definitely getting across, and I think with the recent lockdown and clampdown on this, people are a lot more observant. Certainly, we're seeing far fewer people coming to our hospital, and that's what my colleagues are also reporting. And what we're trying to do is essentially manage people's appointments through teleconferencing, through calling them, through postponing what we can, because really the only people that should be in hospital now are those who need our urgent help and critical help. So we have all been very clear about that. But yes, I think the message is getting across, and it's very reassuring to hear that there is a plan to build more sites and more hospital beds, but that the issue about the community as well, and the people who need to keep working, our frontline staff who are in the community, so that's all the social workers, that's the district nurses, that's our GPs and pharmacists, they also need to be protected as well. And it's really, really important. All of the doctors are calling out for this on their social media platform, that the public please understands that we're facing a national crisis, and they just need to be patient with us and respect the social distancing rules and the bans within hospitals.
Larissa, on the issue of anyone who is pregnant right now, do we have to get used to a new reality that maybe you'll go into hospital without your partner, without any visitors?
Yeah, it is a bit of a grim reality, I'm afraid, in that we are having to limit numbers quite severely. So at the moment, we are allowing a single partner to accompany a woman during labour because that is incredibly important. But when it comes to sort of antenatal care and postnatal care, we have to be really strict with this because anyone else who does come and accompany the patient is also potentially putting other people and healthcare staff at risk. And we just can't afford for that to happen, especially within a very vulnerable group like pregnant women.
Larisa, thanks once again for your thoughts, for sparing us the time and all the work that all the NHS, your colleagues are doing right now.